first, apply for visas. So which type of visas? So there are different types of visas: employer sponsored visas, regional visas, permanent residency visas. So I will explain all those visas in detail. Okay. The next step is intern training program. So you will enroll with Pharmacy Guild of Australia or Australasian College of Pharmacy or Pharmaceutical Society of Australia. So there are different organizations. So this is intern training program. 1575 hours. This is the requirement for the general registration. After that, there is another exam, intern written exam, and after that, intern oral exam. These two exams are during internship. Okay. Once you will qualify these two exams, then you will apply for the general registration to the AFRA. You will pay the fee. Next. Now I will explain all the steps in detail. Step first is skills assessment or documents verification step. So which documents are basically required for this step? So passport, birth certificate, identity card, okay, degree, transcript, category, or you can say registration certificate, renewal of the registration certificate, and good standing certificate from the Peshawar Pharmacy Council, right? And passport size photo. So these are some basic documents which are required when you want to apply for the skills assessment or documents verification step. And the fee is 810 Australian dollars, which is almost equal to 1,50,000 rupees Pakistani. Okay. The time frame for this step is 8 weeks. Okay. Before, the fee was 1,310 Australian dollars, but now they have reduced the total cost on this step, so 810 Australian dollars. So this is the first step. They will send you email that yeah, your documents are okay. Now you can book slot for the KAPS exam. KAPS exam is basically 3 times a year: March, July, and November. So then, what is KAPS exam? What are the basic features? So KAPS exam consists of 2 papers, each of 100 MCQs, and the time allowed for this exam total 5 hours, but there is a break of 1 hour. Okay. There is no negative marking in this exam. Passing criteria is to score 50% in each portion. This is the mandatory thing. There are 2 papers. Paper 1 is consists of 70% pharmacology, 30% pharmaceutical chemistry. But you need to score at least 50% in the pharmaceutical chemistry and at least 50% in the pharmacology. So scoring this 50% in each portion is mandatory. Okay. Now, the fee for this exam is 2,290 Australian dollars, which is almost equal to 4,50,000 Pakistani rupees. So this is the fee for this exam. Next, please. Now I will explain the KAPS exam pattern, that which subjects. So the paper 1 consists of pharmaceutical chemistry 30%, pharmacology and physiology 70%, and paper 2 is consist of pharmaceutics 30%, therapeutics 70%. So you need to score at least 50% in the pharmaceutical chemistry part as well as 50% in the pharmacology part, and overall 50%. Then you will be able to pass the paper, otherwise not. So, and similar is the case for the paper 2. You need to score at least 50% in the pharmaceutics module and the pharmaceutical chemistry. So medicinal chemistry is super important subject for the KAPS exam. You need to memorize the basic structures, the important structures from the medicinal chemistry. And similarly, the important points, you can correlate this medicinal chemistry with the community problems. Like silicosip have sulfur group, so it causes sulfur allergy. Okay, and the for sulfonamide sensitive patients. So link those subjects with the community pharmacy. Analytical chemistry subject, biochemistry, so you can expect 1 or 2 MCQs from these subjects, but medicinal chemistry subject is very, very important. Stereochemistry subject is super important subject in this part. So the pharmacology and physiology. Now pharmacology is very important, but there are some areas which are very, very important, like CVS pharmacology is super important. Along with this, chemotherapy is very, very important. Antibiotics, antibacterials. There are some classes which are super important like tetracycline, sulfonamides, penicillin, cephalosporin. So these are very, very important. And along with this, toxicology, antidote, very important. Okay, what is the antidote for the specific drug? So, pathophysiology, general physiology. Now, physiology, you can expect from the physiology 2 or 3 MCQs, simple definitions, but pharmacology is in very detail. Okay, so these are some of the points. Next, please. So students need to focus on these subjects like pharmacology and the other subject, pharmaceutical chemistry. Okay. So if you are in the final year, so you need to focus on the medicinal chemistry. Okay. Now, pharmaceutics. Physical pharmacy is very important in the pharmaceutics. Biopharmaceutics is very, very important. Calculations are very, very important in the biopharmaceutics. Like how to calculate biological half-life, how to calculate renal clearance, how to calculate hepatic clearance. Okay. So these are some of the subjects. Pharmacokinetics and pharmacodynamics, pharmaceutical microbiology is also important, but not that much. So you can expect 2 or 3 MCQs. Like what is the causality of agent for the cellulitis? What is the name of that bacteria? So formulation, dosage form, including extemporaneous preparation. So this is 30% part. Excipients knowledge is very, very important in the pharmaceutics. You need to memorize all the excipients, which one is bladder, which one is disintegrated, which one is, okay? So, you need to memorize. If you have strong knowledge of excipients, then definitely you will be able to pass this portion, otherwise not, okay? There are some students in this exam, in the March 2024 KAPS exam, they have qualified this 70% therapeutics, but they have failed that 30% part. Okay, so it means you need to pay $2,290 Australian dollars once again for one paper. Okay, because the fee is per attempt, not paper wise. Okay, so the therapeutics and the therapeutics calculations very, very important. Calculations are very important. Okay, like dilutions. Okay, irrigation method. Okay, what is irrigation method? So there are some formulas used for the dilutions like C1V1 equal to C2V2. Okay, there are some other formulas. So calculations are very, very important. Posology and dose determinations. You need to memorize all the doses of the important doses in anti-Alzheimer drug. So 10 mg. Okay, just giving you an example. Okay, after that, medicine choice, drug of choice. This is very important. To the point, specific drug for each disease. Is the medicine choice. What is the drug of choice for the uncomplicated UTI? So that in Australia, the practice is that trimethoprim 300 milligram per 3 days, once in the evening. This is the first line therapy. But in the Western Australia, the first line therapy is nitrofurantoin 100 milligram every DD per 5 days. So it means you need to memorize which one is the first line therapy, which one is the second line, and which one is the third line. Okay, this is basically the therapeutics. Okay, surgical dressing, application, associated drug delivery system. This chapter is important, but not that much. Okay, adverse reactions to drugs, very, very important. You need to memorize the dangerous adverse effects. Okay, like suppose I'm giving you an example. Cisplatin is anti-cancer drug, which causes damage to the proximal part of the nephron. So what you will do as a pharmacist, you will give amicostent to decrease this side effect adverse. Okay. Now, I'm giving you another example like doxorubicin and daunorubicin, which are anti-cancer. So, which causes cardiotoxicity. How to prevent? So you will give dexrazoxone, or you will give vitamin C to prevent this, to decrease this. Okay. So these are some of the basic things which you need to focus. Drug interactions, very, very important. You should expect at least 8 to 10 questions from the drug interaction. Okay? Like, I am giving you an example. What is the interaction between furosemide and digoxin? So it will causes digoxin toxicity. What is the interaction between furosemide and spironolactone? Again, digoxin toxicity. Okay, so drug interaction, please memorize, focus on the drug interaction, okay, and drug information, this is also important. Managing minor elements, this is very important. OTC, over the counter drugs. What is the maximum dose of paracetamol? What is the maximum dose of aspirin? What are the common medications used? Okay, like you can say how to treat constipation, okay, or you can say how to treat diarrhea. What are the basic the drugs which are used in this case?